Well, I think it's whether you're saying we find a way back to it, or whether we are talking about finding a way forward to the kind of budgetary arrangements that you would have in Valencia or Kaiser Permanente. I think there is a very important need for a focus on integration and basing budgetary decisions on prevention rather than cure. So we've got the 44 sustainability and transformation areas that NHS England have announced, which are precisely designed to enable that to happen. And just to be
I can't think of anything worse than having government be more involved in your healthcare instead of less involved. Not only does the president not support it, but America doesn't support it, or Bernie Sanders would be sitting in the Oval Office right now. He pushed these ideas forward during the campaign. They were rejected, not just by America, but Democrats. He didn't make it through the primary. He didn't make it into the Oval. I think that's a pretty clear indication of what America wants to see, and it's not a single-payer system.
More and more Americans understand that our healthcare system is dysfunctional, that healthcare should be a right, not a privilege, that there's something wrong when we are the only major country on earth, the only major country, not to guarantee healthcare to all people. And not only do 28 million Americans have no health insurance, but even more are underinsured with high co-payments and high deductibles. People understand there's something fundamentally wrong when we pay outrageous prices for prescription drugs, far and away the highest prices in the world. And that is something that a Medicare for all single-payer system would lower. So bottom line is, we have a dysfunctional healthcare system which spends enormous sums of money. Healthcare outcomes are not particularly good, right. And people increasingly want to move toward a Medicare for all system.
So I think that the argument that you've laid out from a sort of policy perspective is pretty rock solid. I mean, it is just the fact that we spend more per capita than any other OECD country.
We spend twice as much. Well, because the system is already screwed up. It is screwed up when thousands of people die each year because they can't get to the doctor when they need to get to the doctor. It is screwed up when we are spending $10,000 per person on healthcare, almost 18% of the GDP, and the projection is if we don't make real changes, we're going to spend $49 trillion over the next 10 years, 20% of our GDP, which have very negative impacts on our economy. So you got a screwed up system now. Point is, and let's make this point very clear, because there's going to be a lot of misinformation about it. What this proposal does, what this legislation does, is it eliminates your private insurance payments. So you got the average family now paying $5,000 in co-payments and deductibles. You have families in America paying $10,000, $15,000, $20,000 if they are self-employed. That is all gone.
Right.
And yes, people may have to pay a bit more in taxes, but they will be in better shape financially as a result of this legislation. The truth is, right now, there are millions of people who cannot go to the doctor they want because their doctor is not in their health plan network. So this will give people, in fact, real freedom of choice as to the doctor. Also, this is a good, today at the event we had a businessman from Pennsylvania And he was talking about the huge amounts of money he has to pay for each of his employers,
Right.
which puts him at a competitive disadvantage with businesses all over the world. This will be a tremendous boom for businesses who no longer have to spend incredible time and energy figuring out how they can provide health insurance to their employees. Also, Chris, this will be a major step forward for workers in the sense that we have millions of people in this country today who are at jobs they would rather not be at, but they're there because they get decent health insurance. If you free those people up to do the work they want, not only will it make people happier and more productive, it'll create a real significant step forward for our economy.
All right, Senator Bernie Sanders. Sanders, thanks for joining me.